how do you think that we can bring up this topic easiest with our doctors and it not be passed off as just part of the process? Just generalized period pain.
I think being open and honest about your symptoms and their duration and timing. Women with endometriosis may go their whole lives without having a lot of pain, or may go their entire lives with debilitating pelvic pain. Part of what's hard about endometriosis is it can only be diagnosed surgically. Here's the thing. The primary treatment, 80% of women with endometriosis respond to birth control pills.
Hey, let's add that to the list of things outside of birth control that these can be used for.
And the reason is because when you're on a birth control pill specifically, it evens out your hormone levels. There is no growing of the lining. There is no releasing of an egg. And so if there's no growing of the lining here, it will also prevent it from growing here and here and here. And therefore, when you're on the birth control pill, it will over time help these implants to go away over time. Not entirely disappear, but if they're not growing and shedding, then the amount of inflammation they're causing will be lessened.
Decrease. Wait, I didn't know the tissue could grow here. I was imagining it just outside of the uterus. How did it get there?
Like I said, the cervix is open, and that's how the tissue and the blood are going to come out of the vagina. But the fallopian tube is not a closed off tube to the ovary.
I knew we needed this.
When you do ovulate, the fallopian tube grabs the egg. So when you're bleeding, the blood can come out of the fallopian tube and just into the pelvis out here. Another question I get sometimes is, can endometriosis affect your flow? And really, yes and no. The lining here is not equivalent to the pain and inflammation that's being caused in your pelvis. When these areas are growing and shedding, they're not going to be shedding out your vagina. So you're just going to be experiencing pain primarily. However, sometimes the lining can grow into the wall of the uterus, which is a different diagnosis called adenomyosis. And when this happens, then you have heavier and more painful bleeding. And it is similar to endometriosis, but a little bit different.